Hello, I'm Dr. John Paulson, one of the pediatricians at South Lake Pediatrics. At South Lake Peds, we strive to help our parents use the best child development strategies. Our parent education program is continuing today with a helpful talk by Dr. Anne Skemp. Dr. Skemp has been a pediatrician at South Lake Peds for over 20 years. She is the mom of 3 teenage daughters and works with patients from birth to college age. In her spare time, Dr. Skemp enjoys reading, travel, and cooking. Dr. Skemp is going to share her insights today with a talk called Tips for Feeding Picky Toddlers. Welcome, Dr. Skemp.
Thank you, Dr. Paulson. I'm Dr. Anne Skemp, a pediatrician at South Lake Pediatrics. Do you have a toddler who's picky at mealtimes? You are not alone. Today, I'd like to share with you my top tips for feeding picky toddlers and preschoolers. Why are toddlers so picky? Picky eating is one of the most common problems that we talk about at Well Child Checks. It's especially common in toddlers and preschoolers between the ages of 2 and 5, but definitely lasts longer in some children. When toddlers are transitioning from eating baby foods and purees to the same foods as their parents and the rest of the family, everything is new and super unfamiliar. Foods might have textures that require more chewing, or flavors that are more savory and salty instead of sweet. Foods look different, unfamiliar, and are sometimes even green colored. Toddlers naturally dislike unfamiliar new things and love to say no to everything, even things they actually do like. What's normal at their age? The good news is toddlers are also excellent learners. They absorb information from the world around them like little sponges. They learn through trial and error and by watching the people around them, including their parents and their siblings. Their language, fine motor skills, and gross motor skills are all growing every day. Also, keep in mind that it's normal for their appetite to go up and down day by day. Some days they might eat a lot, and some days much less. It helps to have a daily routine. So, having a predictable routine like this with a set meal schedule every day does several important things. It means they're not grazing or eating little bits of food throughout their day. This makes them never develop a feeling of being hungry enough to eat a full meal. So, always avoid giving snacks or milk for at least 30 minutes before you expect a toddler or preschooler to sit down and eat. They do get used to a routine if they know what's happening next. The best place to eat is at the table. Kids should never be walking around and eating their meal or having someone feed them while they walk around. This increases the risk of choking, which is a safety hazard. Once they get up from the table, the food should go away and they're done with the meal until it's time for the next meal. For very young toddlers, it's helpful to use something like a high chair or a booster seat or a child seat with a little seat belt at the table so they aren't constantly climbing around and climbing out of their seat. Try to stick to the rule of once you get down, you can't come back. So what about screens? Using digital entertainment to distract toddlers while they eat prevents them from noticing or participating in their meal. They're more likely to overeat when they're distracted. Focusing on the food helps them appreciate new flavors and new smells and helps them learn to feed themselves. Family style, if possible, try to eat together as a family at least once a day. Meals are supposed to be a social interaction. Sometimes this works better at breakfast or lunch instead of dinner if everybody's family is busy like our family is. How about new foods? Keep offering your toddler or preschooler the same foods that the rest of your family's eating. Sometimes these will be foods that he or she hasn't experienced before. So this is where you set a good example by enjoying those foods yourself. Toddlers might need to see, smell, or touch a new food 10 or more times on 10 or more different days before they accept them and like them. Include familiar foods that you kind of know your toddler is going to like milk, usually bread or pasta, and fruits. So speaking of milk, how much is too much? Some kids do love milk so much that they prefer to drink it instead of eating their food, and this can lead to other medical issues like low iron or vitamin deficiencies or constipation. So it's good to keep an eye on that. A 1 to 5-year-old child really only needs about 6 ounces of milk 3 times a day. If you're getting worried that your child is maybe drinking too much milk, try to save the milk for the end of the meal instead of at the beginning so you can be sure that they're eating their food. If they're thirsty between meals, try to avoid giving more milk. It's okay to give them as much water as they want. So here we come to the part of how to make it fun. It can be easier for kids to accept new foods if they're helping in the kitchen. Even a super young toddler can help to stir something in a bowl or just pretend to with a little toy like bowl and spoon, or mix a salad. Or you could give them 2 options to choose from, both of which are healthy, like carrots or corn or broccoli or green beans or something like that. Here's the part where I'm going to tell you a little recipe that might make vegetables a little easier for your toddler to accept. What you do is you preheat your oven to 425 degrees. Choose almost any vegetable. You can do this with cauliflower, broccoli, sweet potatoes, regular potatoes, carrots, almost any chunky vegetable. Cut it into bite-sized pieces, put it in a big bowl, add a tablespoon of olive oil. This is where the toddler can help with stirring this all up with a big spoon, and then empty the whole mixture onto a cookie sheet and sprinkle it with some salt and pepper, and then bake it in the oven for like 20-30 minutes until it's really soft and tender and kind of brown and toasted looking. So that's a healthy side dish that your toddler hopefully will be willing to try and taste, and that the rest of your family can enjoy as well. Finally, check in at your checkup. Your child's regular pediatrician or nurse practitioner can go over your child's weight and height with you to see how they're growing. We can offer more tips if you're running into any tricky feeding issues. Thank you so much for your time today. Check out some of our other parent education program videos at the link below. And if you have any questions, please feel free to visit us at southlakepediatrics.com, or you can give us a call at 952-401-8300 to schedule a visit.